My name is Dr. Michael Major, and as we continue our conversation with children and sleep problems, I want to sort out and point to something that's different, that children and adults are not the same. There are similarities in the disease and the problems for sure, but that they're not identical. Now, many of the batteries and the tests and the other underlying physiology can be similar, but for adults, usually the problems sit somewhere in the throat, somewhere in the oropharynx. And so that's why we have risks of things like neck circumference. We have risks of retrognathic mandibles as being really, really important risk factors that we want to be looking at as we're doing our clinical screening for adults. In contrast, children's problems tend to be somewhere in the nose and the nasopharynx. So the problems for kids that are more common are things like chronic allergic rhinitis, things like adenoid hypertrophy. We want to be looking in those zones instead, because the problems for kids are usually somewhere in the nose, the problems for adults are usually somewhere in the throat. Now, there are exceptions to this rule, and we're going to get into them in the future of these little videos, but as a general frame to be having in mind as we go further into this conversation, for adults, the problem is usually somewhere in the throat. For children, the problem is somewhere in the nose. If you got a case you want to discuss with me specifically, though, feel free to shoot me an email. It is mpmajor@ualberta.ca. I hope you're having a wonderful day, and I'll see you again soon.